Assalamu alaikum friends, welcome to my channel MBBS and BDS lectures. Today our topic is related to dental cement, calcium hydroxide cement. Before going to explanation, if you want to watch the same lecture in Urdu Hindi, I already upload the same lecture in Urdu Hindi on my YouTube channel. Go and watch that video. But if you want to watch in English language, then this video is for you. Now, first we start from calcium hydroxide presentation form. Presentation form means in which form calcium hydroxide are available. Now, the first form of calcium hydroxide is calcium hydroxide powder. Mean calcium hydroxide are available in the form of powder. Second form is toothpaste. In toothpaste, like toothpaste, in toothpaste, one paste consists of base and other paste consists of catalyst. Now, the composition of base and composition of catalyst. There are four things in the composition of base. Number one is calcium hydroxide. Number two, zinc oxide. Number three, zinc acetate, which acts as an accelerator. Means it increases the reaction. It accelerates the reaction. And number fourth is liquid vehicle. These are the four components of base. Second, catalyst composition. Catalyst consists of disilicylate, radioofficifiers and fillers. Now, calcium hydroxide is a base and zinc acetate is an accelerator. Radioofficifier give radio opacity to calcium hydroxide cement and fillers give strength to calcium hydroxide cement. This is the first presentation form. Now come to the setting reaction. Now, before setting reaction, how we mix the two paste system of calcium hydroxide. First we take a glass slab or paper pad. On the glass slab or paper pad, we take a equal length of two paste. One is base paste, other is catalyst paste. We take an equal length. Then we mix this two paste, mean base and catalyst. This is the mixing procedure of calcium hydroxide cement. Now, after mixing, there will be setting reaction take place. Now, setting reaction. Now, how calcium hydroxide is set? Calcium hydroxide is set by acid-base reaction. Now, why it's set by acid-base reaction? Because it consists of base and acid. The base is calcium hydroxide and the acid is disilicylate, zinc acetate. Therefore, calcium hydroxide cement set by acid-base reaction. Now, the third heading is material characteristics. Now, we will study the material characteristics like biological characteristics of calcium hydroxide, mechanical characteristics, interfacial characteristics, its chemical characteristics. First we start from biological characteristics. In biological characteristics, calcium hydroxide acts as a bacteriostatic. Now there are two words. One is bacteriostatic and other is bactericidal. Bactericidal means to kill the bacteria and bacteriostatic means to stop the growth of bacteria. Now calcium hydroxide is bacteriostatic, mean it stop the growth of bacteria. Which bacteria? Which is carcinogenic, which cause caries in the tooth. Second biological characteristics is neutralize the acid produced by carcinogenic bacteria. Now, how tooth decay takes place? When bacteria produce the acid, these acid dissolve the tooth structure. Now, calcium hydroxide is base. It neutralizes the acid which produced by carcinogenic bacteria. The third biological characteristics is help differentiate pulpal stem cell to produce reparative dentin. Now, when we prepare tooth cavity, accidentally when we expose the pulp, in result there will be bleeding and there is severe pain to patient. Now, at that time, we cannot do filling. Now, what we do? We give calcium hydroxide as a direct pulp capping and say to patient, you come in next visit after 1 to 2 weeks. In 1 to 2 weeks, the calcium hydroxide stimulates the stem cell of pulp to produce the reparative dentin, to produce the tertiary dentin. When in next visit patient come, above the pulp there will be reparative dentin. Then we give the filling to the patient. We fill these tooth which have reparative dentin above the pulp. Now, these are the three biological characteristics of calcium hydroxide: bacteriostatic, neutralize the acid. Number 3, differentiate the pulpal stem cell to produce reparative dentin. Now, second is mechanical characteristics. Mechanical characteristics mean when forces is applied. Now, calcium hydroxide is a weak cement. Why? Because it could not withstand the condensation forces of amalgam. When we place the amalgam in the prepared tooth, then with the help of condenser we condense the amalgam in the prepared cavity. Now, calcium hydroxide is a weak cement. It could not withstand the condensation forces of amalgam. Now, after mechanical characteristics, we will study the interfacial characteristics of calcium hydroxide. Now, in material characteristics, the third characteristics is interfacial characteristics. What is interfacial characteristics? Interfacial characteristics mean between two faces. What is two faces? This is prepared tooth cavity, and in prepared tooth cavity we place a calcium hydroxide cement. Now, there are two faces, one face of material and one face of tooth repair cavity wall. Now, interfacial characteristics mean either calcium hydroxide is chemically retained or mechanically retained. Chemically retained mean calcium hydroxide make a bond, a chemical bond with a tooth wall, like glass ionomer cement, GIC. GIC make a chemical bond with the tooth wall. But calcium hydroxide is not chemically retained. It does not make chemical bond. It is mechanically retained. Its retention is mechanical. This is interfacial characteristics. Fourth material characteristics is aesthetic. Aesthetic characteristics. Now, calcium hydroxide is opaque. Why it is opaque? Because its catalyst composition have radio opacifier, like we already studied in composition. Now, calcium hydroxide is opaque. Do not use to dilute translucent ceramic restoration. Now, we cannot use calcium hydroxide to dilute or for cementation of ceramic translucent restoration. Why? Because it is opaque and ceramic restoration is translucent. Now, due to translucent, we can see the inner radio opaque calcium hydroxide. Therefore, the ceramic aesthetic will be deformed. Why? Because we can see the inner radio opaque calcium hydroxide from the outer surface of ceramic. Therefore, it deforms the aesthetic of ceramic. Therefore, do not use as a luting agent, as a cementing agent under ceramic translucent restoration. Now, fifth is chemical characteristics. In chemical characteristics, calcium hydroxide is dissolved in fluids. Now there are two types of fluids. One is water, one is oral saliva. Calcium hydroxide is more soluble in water but less soluble in saliva, oral saliva, as compared to water. This is the chemical characteristics. Now material characteristics is complete. We studied the biological characteristics, mechanical characteristics, interfacial characteristics, aesthetic characteristics, chemical characteristics. Now the last studying of calcium hydroxide is application or usage of calcium hydroxide, mean where we use calcium hydroxide. Now the first use of calcium hydroxide is a direct and indirect pulp capping agent. Now, why we use calcium hydroxide as a direct or indirect pulp capping? Because we already studied in biological characteristics, calcium hydroxide stimulates the stem cell of pulp to form the reparative dentin or tertiary dentin. Therefore, we use calcium hydroxide as a direct or indirect pulp capping agent. Now, what is direct pulp capping agent and what is indirect pulp capping agent? Now, like we prepare the tooth cavity and below there is a pulp. Above there is an enamel and dentin. When we prepare the tooth cavity, when we remove the caries, first when enamel is involved, the enamel caries we remove, then we remove the dentin caries. But when caries is deep, near toward the pulp, then the soft caries is come. When we remove this soft caries, accidentally, sometime the pulp become exposed. In the result, there will be bleeding and there will be severe pain. Now, like here, this is the dentin and this is the pulp. When accidentally we remove the deep soft caries and accidentally we expose the pulp, now the bleeding starts from pulp and there will be pain. Now, what we do? We cannot place restoration in this prepared cavity. First, we use calcium hydroxide dressing above the pulp, calcium hydroxide dressing, and send the patient for 1 or 2 weeks for rest, and then call the patient for next visit to come after 1 or 2 weeks. Now, what occur in these 2 week. In these 1 or 2 week, the calcium hydroxide dressing stimulate the pulp, and in pulp the stem cell differentiate to form a tertiary or reparative dentine. When they form tertiary or reparative dentine, when in next visit patient is come, we give a restoration in this repair cavity. When we directly place the calcium hydroxide above the pulp, this is known as direct pulp capping. What is indirect pulp capping? This is again pulp, and this is the tooth cavity. When we remove the caries from enamel, again from dentine, when directly pulp is not exposed, but there is a very thin layer of dentine about the pulp, and there is a more chances of pulp exposure, then we place a calcium hydroxide above this thin layer of dentine, calcium hydroxide dressing above the thin layer of dentine. This is known as indirect pulp capping, because we do not directly place the calcium hydroxide dressing about pulp, we place the calcium hydroxide dressing about thin layer of dentine. Mean indirectly, mean become between calcium hydroxide dressing and pulp there is a thin layer of dentine. Now the calcium hydroxide is indirectly above the pulp. This is known as indirect pulp capping. Now first application I use is, we use calcium hydroxide as a direct or indirect pulp capping. Second is a cavity liner. Cavity liner, when we give a restoration, now from restoration the leaching occur, the material leach and move toward pulp. Now what we do, how we stop this leaching from material? We place a thin layer of calcium hydroxide as a liner below restorative material, thin layer of liner of calcium hydroxide to prevent the material leaching from restorative material toward pulp, because this leaching material irritate the pulp, in result there will be pain. The third use is an endodontic sealer. We use calcium hydroxide as an endodontic sealer. What is endodontic sealer? This is root canal, and for sealing the root canal and for filling the root canal we place the root canal filling material. This is root canal filling material, and there is a space between root canal wall and filling material. To fill this space we place a calcium hydroxide as a sealer material to seal the space between filling material and root canal wall. This is the third use or application of calcium hydroxide cement. The fourth is temporary cementation. We use calcium hydroxide as a temporary cementation. Mean, this is prepared tooth, and we take the impression of this prepared tooth and send to the lab. Lab make the crown of this prepared tooth. When crown is reached, when we do cementation of crown, luting of crown, first we apply the calcium hydroxide above the prepared tooth, then we place the crown above the tooth, and the calcium hydroxide lute cement this crown with the prepared tooth. Mean calcium hydroxide act as a glue to between crown and repair tooth. This is the fourth use as a temporary cementation. Now today we studied the presentation power of calcium hydroxide, its setting reaction, mixing, material characteristics, application or uses. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon to open all notifications in order to you receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.